Hello. Thank you for joining me today. This is Dr. Rachel Gilmore with the Foundation Chiropractic if you're new to my channel, and welcome to the first long-form YouTube video. I'm going to talk about a topic today that's really near and dear to my heart because it's affected so many lives of so many patients that I've been able to fortunately treat and hopefully impact their lives so that we can not only get them out of pain, but get them to full strength. And now that's a conversation for another day. So we're not going to talk about strength or flexibility today. What we're going to talk about, as you can see in the title, is how your breath relates to your pain response. Now, I've got a couple blog posts on this already about mindfulness and about stretching and why your stretching may not be relieving your pain and how the changes in your brain can actually affect your pain response and how you can effectively control this pain response. Now, your body has certain mobility in certain joints naturally. So why is it that your body prevents you from accessing the mobility in certain joints and the ability to actually utilize that mobility in your daily activity or in your strength training or in your exercise or performance or any of that? If we are not able to move into a joint's range of motion and access it, the body will create undue tension and various symptoms, even pain in your body. So if we're actually able to relax the body into a state where you're able to access the range of motion, then our pain response and our threat is decreased. Now, the reason why we're able to relax into the range of motion and things like yoga and sometimes stretching will allow us to get a little bit further into the body than we're maybe able to. Say in a forward fold, you're not able to bend down very far, but once you're in a relaxed state, you're actually able to bend a little bit further. It has to do with the parasympathetic nervous system. Now, if we are in a constant state of tension in fight or flight, where we're stressed and we've got all sorts of things that we're dealing with and things that are on our mind, that has to do with your sympathetic nervous system, that fight or flight, that stress response that actually we find so many people in nowadays, where their stress response is so elevated that they have more pain, they have more disease, and it just causes a whole host of issues with the person. And essentially, if we're continuing along this stress cycle, circling the drain, if you will, the endless cycle of stress, then it can just heighten that pain response and heighten that sense of sometimes tension for people. Sometimes it's pain for people in their body. Sometimes it just starts, like I said, with muscle tension, muscle tightness, and then over time things get irritated. You have more inflammation and the cycle of chronic pain begins or gets worse depending on the person. Now, as far as injury goes, I've said this before on my Instagram page and on Facebook and other things, we're not talking about necessarily an acute injury yet. Once it progresses, then we can start to begin this conversation. We're not talking about a sports injury or something like that. I'm talking about the people that have had chronic pain and you've tried everything and you just can't seem to get that pain to go away. Chiropractors have helped. Machines like the one behind me, the stim unit, has helped. Massages help. Yoga or YouTube exercises have helped, but it just can't seem to get it to go away. What do we do in this case? Where do we start? What does your body need from you to be able to actually relax and to be able to give yourself the gift of being pain-free? And being pain-free, we can talk about that later on, is also a concept that, as I get into practice a little bit more, I'm not so sure that we can be completely pain-free. However, the point of this is using the tools that you have inherently in your body and innately to allow yourself to connect to your body more, to connect to your mind more, and to be able to open up mobility and open up that sense of control over your pain response. One of the things that I always start with people when they come into my clinic, especially if they're in a heightened sense of pain and stress in their body and just feeling that sympathetic state, that stress response, that pain response that just continues or gets worse or never seems to relent, is the breath. we start with breath work, we start with breathing. And there's a reason for that, because once we open up the diaphragm, we allow you to breathe into areas, like I said, of your body that are tense, whether it be up here in the neck, whether it be in the low back, whether it be in the mid back, sometimes other areas, allows you to get into the parasympathetic state to reduce the stress response in your body using your breath. It takes the stress response down. It takes that red flag, that is seeming red flag that, oh no, don't do this movement, sending out pain into your body, back into a state of normalcy. Your body wants to be in a state of homeostasis, a state of evenness, a state of being able to move normally and being able to, do different tasks and things like that. Your body doesn't like being in a constant stress state. So if you have been in this state before, say you've got a meeting or whatnot that's stressing you out, or maybe kids at home or stressing you out, or family life or whatever it is, and you feel tension in your body a lot of the time in the neck, especially for my women and a lot of men too. And it could be due to things like repetitive action at work or at home, or sport, or different variables like that. There's a whole host of variables that we're not going to cover today. Things like hydration, nutrition, sleep, and different things like that. I talk about sleep on my Instagram 2 days ago. Go check that out if you're watching this. Today is June 12th. So if you're watching this, it would have been in the middle of June if you're watching this at a later date. Now, this is not per se a strength conversation, or even a flexibility conversation for that matter. Those things are vitally important, very important. Mobility, strength, making sure that we have the stability in order to support motion and performance. Those things are great, but if we can't actually access the mobility and the range of motion in our body and be able to, increase that performance through that and through stacking strength, then we're not going to be able to achieve the goals that we really, truly want. So you need all three of these things. You need mobility, stability, and strength to be able to actually have that maximal performance. And in my opinion, you also need to be able to achieve that mental resiliency that I talk about a lot, the state in the body where you can connect to the body and mind in the same token. Things like yoga have been super effective for years, but I still find that yoga teachers find themselves in my office and people who, do healing practices, because even when we are the best at certain things, we still may find ourselves in that endless loop sometimes. Now, I want to connect all this together for you with a story about a recent patient who came into my office. We're going to call him Bob for this case. So, Bob is an executive. Bob has a lot of stress in his life. Bob has new family needs that have come up, and new reasons to, need financial freedom and financial support for his family. He's a very high achieving person and has, really intense thought processes and goals. And, Bob just found himself in chronic pain, and he's been dealing with this pain off and on for, years, and found himself in my office because a friend told him about me and about what I do, and, said, hey, why don't you go check this out? Why don't you go try this? Bob's been to chiropractors for years, and he gets relief. Bob told me that, he may go to the chiropractor once or twice a year, and it miraculously cures the pain that he's in. Bob also told me that he is going on a trip soon and wanted to be able to pop up onto a surfboard because that's something that he enjoys, and we wanted to give him that as well too. Now, when Bob came into my office, it took, just a little bit to get him comfortable, to get him to open up to me just a bit. That's one thing that I do differently with people. And whether we're online or in person, I like to be able to connect with you and let you tell your story, because this may be the first time that you've actually told your story to somebody. So to me, that's super important to be able to find that. Now, let's fast forward a little bit into the treatment, because this is where it gets really interesting. So we did our normal exam with Bob and, found what we thought, and we're going to talk about the neck in this case. So nothing too serious. Bob didn't have any crazy pain down the arm or anything like that, but he had some intense neck pain and just intense tightness that, is just continuing, and that he's finding that is just unrelenting, that seems to get worse by the end of the day, especially after a long, stressful day. And that seems to just persist no matter what he does. So we got Bob into the treatment room right behind me. And as we progressed into treatment with Bob, we started our breathing practices. And at first, I do a little bit of soft tissue work. Sometimes if you're in immense pain and you find yourself physically in my office, I'll combine it with things like stem or ultrasound or different modalities like blading or cupping, whatever seems to work for the person or whatever in your experience has worked in the past. We'll use some of those modalities. Now, the modalities are not important in this case, actually. What I'm about to tell you about is more important. So putting my hands physically on Bob and actually starting to go through some mobilization. And yes, we did a little adjustment in Bob's neck in a couple places. And we got Bob to start breathing before that. We got him to relax. He closed his eyes. I didn't ask him to do that, but I said, connect to a place that you find peace with. Go to the place that you're happy, whether that be a vacation place or whether that be someplace in your mind with your family or an experience that you've had in the past. And you can try this at home. I urge you to try this with me. If you're listening to this story and you found this video useful so far, I urge you to try this. And my goal is to have some more things like meditations and breath work videos that can help guide you through this process in the future. So stay tuned for that. Now, what was really cool is that as we were going through breath work with Bob, I said, all right, Bob told me before we adjusted his neck actually that he seems to tense up and that, chiropractors sometimes have difficulty adjusting him because of the tension in his neck and because of the response that he elicits, from having somebody try to manually work on him. And before we started, I put my hands on the sides of Bob's ribcage and I said, all right, what I want you to do now and what you can do at home is to breathe into your ribcage as if the sides of your abdomen, of your midsection, are expanding so far to touch the wall. I don't just want you to breathe into the belly. I don't just want you to breathe into your back, as some people talk about, and I've talked about on YouTube videos as well too. I want you to connect to that breath and go to that place. And as I was working on Bob, and I'm not going to say that the physical, what I did, the adjusting, the manual work was what helped him that day. As we went through this process and as I guided Bob through the breathing and the relaxation with words and with the gift that comes out when I'm working with people in some cases, Bob started to relax. We were able to achieve the adjustment that we needed. We were able to get some of the tension relieved by some stretching techniques. But what's really important about this is that when we finished everything and when, we were done with our manual stuff and we just connected to the breath a little bit more and I took Bob through those breathing practices, he said, wow. And what I saw in Bob, even as he went to leave 20 minutes later, because we do a little bit longer appointments here, he seemed to have achieved what I would call a sense of flow state, a calmness, a peace that reverberated throughout his body and throughout the room, a new sense of mindfulness, a new state of self that he was in, a relaxation through connecting with the breath in the nervous system. Now we know from the research that a chiropractic adjustment can have an effect on the nervous system. It can either upregulate or downregulate certain processes in your body, and it can help. But why did Bob achieve this state, whereas before it hadn't stuck? It hadn't lasted as long. I truly believe that because we got Bob to connect to his parasympathetic state and actually relax his body into those areas and to pay attention, to call attention to the areas that were so tight in him, that we were able to help him with that day and give him something that he can practically go home and utilize. It's just an amazing thing. Comment below if you find any revelation with this practice as you do it on your own and at home. I truly think that this is something that can really impact a person, and this is something that has allowed me to help regulate my nervous system and anxiety and my pain experience, because I too am a patient of chronic pain, have been in since high school, since I had a car accident. I'll tell you more about that at a later date. We've seen in recent years of research that mindfulness actually and meditation have had significant impact on the ability for your brain to change both structure and function, especially when it's concerning your pain response. Now, why is this? Some of you watching may have never heard that before. Part of my practice is connecting you to the mental resiliency that you have and to that state of mind and the state of being and the ability for you to, as I say, control the pain response, to be able to move effectively. And movement's a huge part of this. We did some movement with Bob that day. We're going to continue on strengthening and, really fulfilling the entirety of what I call the care plan for a patient. Now, if you're online and you're watching this and you're wondering how I can help you, we'll talk about that as well too. But let's get back to the brain and how it actually changes structure and function within your brain and the ability for it to modulate that pain response. It's a really cool topic. I talk a lot about neuroplasticity, the ability for your brain to change the way that it fires and wires. What we were taught in school and what I've heard forever is a brain that fires together, wires together. And a brain that does not fire together has disconnect. It does not wire together. It has a sense of separation with certain connections. We call those synapses, and the neurons that connect at those various junctions in your brain to be able to do daily processes. Even me talking to you today, all of these synapses are firing, all these neurons are firing and connecting together to create this wonderful video that I'm sharing with you today. One study that I found when I was looking a little bit deeper into this to give you guys a little bit of solid evidence was that mindfulness meditation practices actually outperformed what we call a placebo, a sham treatment in this study. And it was significant. Now, let's talk about that. What is a placebo? What is a sham treatment? Now, placebo is something that is meant to have a therapeutic effect to the patient, but it doesn't actually have an effect. So it'd be like taking a sugar pill versus actually taking a pill in a pharmaceutical study, if you will. Now, why is this significant? What this means is that through meditation, mindfulness, meditation, we're actually able to consciously control the outcome of pain and the response of pain in our body compared to the sham treatment. Now, I'll just be open and transparent because I also come from a place of research. I'm still active in my university that I went to for chiropractic school and want to be completely real with you and give you the real evidence, especially for clinicians out there that might be watching this. I have not reviewed the specifics of the study yet, okay? So maybe for a future video update. There may be errors, there may be things like that. However, what I've seen right behind me and what I've seen in various gyms that I've worked in with patients is that over time, changing that mind connection and putting you into that state of relaxation and teaching you the breathing techniques that you can then take home while combining it with movement and exposing your body to those movements to help desensitize the pain response, and probably through a little bit of psychology, through a little bit of changing the way that you think about and interpret your pain experience and your response. I've seen the same thing. The adjustments when I was in a high volume clinic, in my experience, helped combined with psychology. Some people got better, some people got better completely, and they never came back, at least for a couple of years or for 6 months, or in some cases, in very wild cases, 10 years. But why is it that I'm able to now teach people these same techniques and tactics to be able to relax your body? And what kind of changes does it actually have? Let's talk about that a little bit more. Now, these researchers have pointed to 2 specific areas of the brain that are related to the self-control of pain. Now, for those of you not familiar with neurology, this is not super important, but for those of you that do want to look into this a little bit more, those 2 areas are the orbital frontal cortex and the anterior cingulate cortex. Like I said, those 2 areas are related to the self-control of pain. Now, this anterior cingulate cortex is a part of the limbic system, and part of that, it's related to the control of emotion, and it's related to emotion that you experience. A lot of the time, pain patients have emotion attached to their pain. They may or may not know that they have emotion attached to their pain, but part of the pain experience does have to do with emotion and the psychology that we experience. So if we can teach you a new emotion attached to your pain, maybe instead of, feeling like a victim to your pain, feeling like you can't do anything about your pain, like I had to do, actually. I'll be a little bit vulnerable with you guys here. Once I detached from feeling like I had to fix myself and feeling like I had, to really figure this out, and I had to put the puzzle together, and I was obsessing over details and things like that. And once I took that self-control back to myself and connected more to my body, I haven't dealt with as much pain. And I teach people how to do this every day, every day. When we see somebody that is in a cycle of chronic pain, there is actually evidence out there in MRI studies and different brain imaging that has shown that there are changes structurally in the brain that relate to things like anxiety, things like depression, and impaired cognitive function. So we are actually showing that brain structures tend to fire differently, tend to send out different signals and different emotions in your body as this all relates. Hopefully, this gives you a little bit of a sense of empowerment that you can help yourself through simple mindfulness practices and through things like meditation that help you connect more and relax the body more. Because through your relaxation, through you connecting to your body more, to mindfulness more, through practices like meditation, through yoga, through whatever fits your fancy, whether it's just sitting, breathing, or sitting in the quiet, and just reflecting and having that connection, you can begin to develop a sense of more empowerment and affect the control over this pain response that's in your body. Simple things like breathing. If you're interested in that a little bit more, I have a couple of more exercise geared breathing videos on this channel, so be sure to check that out. I'll try to link that here at the end. And just remember that you have the power within you to not only change your brain through concepts like neuroplasticity and that structure functional change in the brain, but through becoming a more empowered self, having that sense of mental resiliency where you can do these hard things. And through simple practices, you can and will change the result of pain in your body. I hope you enjoyed this video today. I hope you got something out of this video, and if you have more questions or if you have comments, feel free to share those in the comment section below, or feel free to reach out to me. I'll put my contact information in the description box for this video. And I had a wonderful time chatting with you guys today. And like I said, I hope that you got something from this, and I hope that you got a solid lesson that you can take with you in your day-to-day life and actually help yourself become more empowered and live in less pain. I wish you all well. I hope that you all stay very blessed. And like I said, if you like this video, like and subscribe and share it with a friend so that I can put out more content to begin to help you on this journey to live a better life. Until next time, have a blessed day.